Now let's talk health. The Nigeria Center for Disease Control and Prevention has raised fresh concerns over the increasing number of cerebrospinal meningitis cases across the country. The latest figures show 807 suspected cases and 74 deaths reported across 22 states and the Federal Capital Territory as of the 26th of March this year. Director General of the NCDC, Jide Idris, says the agency has activated emergency response measures to curb the outbreak, particularly in Kebbi, Katsina, and Sokoto states. He mentions that health authorities confirmed 248 suspected cases and 26 deaths in Kebbi State. 70 suspected cases have been recorded in Gombe State, with 31 confirmed infections and 3 fatalities. Dr. Idris advised residents to seek medical attention immediately if they experience any symptoms. He emphasized that the agency has deployed rapid response teams to work with state government in the hardest hit states to conduct mass vaccination campaigns and strengthen case surveillance. Well, let's talk more about this outbreak of cerebrospinal meningitis. Joining us from on that is the Vice President, of the Medical Initiative for Africa, Dr. Ebuta, who joins me via Zoom from Abuja for more. Dr. Ebuta, good to have you join us at this time. Explain to me like a 5-year-old. Yeah, so explain to me like a 5-year-old. What exactly is cerebrospinal meningitis? What are its symptoms and how is it diagnosed?
Okay, so around your brain, under the thick, very thick bony skull, around the brain is a thin layer of a tissue. That's called the meninges. So that is like a thin layer of tissue, and it has some fluid around it. For any reason, that tissue is infected either with viruses, bacteria, or parasites, that tissue would now become inflamed. Now, the tissue is called the meninges, and any infection there making it inflamed is called meningitis. So many things can cause meningitis, but CSM, which is of interest to us, is a major cause of meningitis and death, and is responsible principally for the outbreaks we have. So it's basically caused by a type of bacteria. Remember, we said the infection can be bacteria, viruses, or parasite, but this particular one is a bacteria, and it has a nice name called Neisseria meningitis. And there are actually 5 cousins: cousin W, cousin A, cousin C, cousin X, and cousin Y. So the present cousin that is responsible for this is comfortably or interestingly cousin C, because cousin A has been significantly pushed aside by previous vaccination effort. Now, what are the symptoms? Once you come in contact with this, with the infection, which can usually go through the nose or the mouth, through the airway, within 48 hours to as much as 240 hours. So within 2 days to 10 days, a patient can start developing symptoms. But most patients will develop symptoms within 4 days. And once they develop symptoms, within a day to 2 days, they can die. And the symptoms are very common. They are easily to recognize, and that's a good thing for us, so we can pick patients early. Headache, fever, backache, and very, very importantly, stiffness in the neck. Other things like vomiting may also be noticed. So to a large extent, it's easy to recognize, but it's deadly and can cause death in as much as 1 out of every 10 patients affected.
All right, so what age range is more susceptible to meningitis, and what preventive measures are available?
Age range, to cut the story short, we simply say extremes of ages. But the data we have is that more than 90% of people are affected are between the age of 1 year old and 15 years old. But the group affected are commonly extreme of ages, and people who have immune problem, immunocompromised people, people who are diabetic, they are not properly treated, HIV that are not properly treated, cancer on cancer medications that are not properly treated, and malnutrition. In fact, malnutrition is a major contributing factor to patients' increased susceptibility. And in terms of treatment, like we said earlier, within 24 hours, 48 hours of developing symptoms, patient can actually develop headache, seizure, and they can die. So treatment will involve giving them medications that will kill that bacteria, and the medications are basically antibiotics. Now, the challenge with the health system is the availability of these medications being readily available at the point that you suspect, because we may not even have time to take the fluid from the brain using the spinal cord route to test and confirm. So most times we treat symptomatically based on suspicion when we have this kind of outbreak. So antibiotics are a major factor, but you need other supporting factors. But it's always better to prevent it, and we cannot treat everybody who would come up with meningitis. Most will die, especially because of weak system. So the major step we need to take now is what happened in 2023, 2022, where after deploying a vaccine, we were able to cut down cases significantly. So massive effort towards vaccinating our people is critical.
All right. And beyond vaccination, what more can we do? Because we understand that about 74 deaths have already been reported so far as of 26th of March. As individuals, what can we do collectively? How can we help the situation?
As individuals, once you see anybody with headache, fever, and a stiff neck, you have to get that person to a facility where the admission services and health workers who can administer and make diagnosis and administer life-saving antibiotics. As a community, we need to increase knowledge and awareness about meningitis. We need to come together to encourage our people to move from vaccine hesitancy to higher vaccine uptake, since we know that vaccination is critical and important. The government and non-governmental organizations are already responding to this. We know the Nigerian Center for Disease Control and Prevention has deployed their staffs to about 14 states, and they will be there for a significant period of time supporting local action. But it's not really going to be about the federal government. The local government, the state government, non-governmental organizations must come together to increase knowledge about the symptoms, which are headache, fever, and stiff neck, access to treatments, meaning that we must deploy antibiotics, we must quickly train our healthcare workers at the primary healthcare level, and we must provide them with the drugs available. The drugs must be there waiting for patients. We cannot be looking for drugs when patients arrive in the hospital, for example.
All right, Doc. Vice President, Medical Initiative for Africa, Dr. Ebuta, thank you for joining us on TVC News at 10.
Always a pleasure. Thank you.